The Rural eHealth program has been very successful to date, and that's because of the people that we've got working on the program.
Staff across LHDs working in partnership and learning from each other.
Removing barriers, resolving issues, coming up with solutions, facilitating discussions and working with each of the relevant stakeholders to achieve a desired outcome that actually keeps us moving forward.
There has been incredible dedication right across the state, from the project teams in eHealth through to the local teams.
My role is the implementation lead, and I do that for the Western New South Wales Local Health District. There's another 5 of me in other local health districts.
I create the connections and the pathways with the various clinical and non-clinical managers and executive, and help them understand what that technology is going to mean for them.
As a change manager, I come in and work with the site to understand how things will be different.
They have been working very closely with the clinical staff to help them understand what is the impact to them as we go live with these systems.
We have e-clinicians, which are specialists that stand from the perspective of a clinician, but also have the ability to wear a technology hat and try and marry the two positions.
And then we've got the business analysts, which will understand the business a lot more and try and adapt the programs to their business, not the other way around.
My role is as the Rural eHealth trainer, and I train the trainers, and then they will then go on and do the training sessions with the end users.
Before we start training and we go into the go lives, we go out and we speak to the site. We like to accommodate them the best way that we can. So whether that is, smaller blocks of training, a 4-hour session in the morning, different session in the afternoon, or whether they block out a full day's worth of training.
But bear in mind, a lot of the training also takes place in the go live period.
We would spend 1 or 2 weeks on the floor with the clinicians, helping them one-on-one.
And they're not only there for the actual day of the go live, they're there for a couple of weeks, and then they turn around, go back and visit that site again, 2 or 3 weeks down the track to come back and make sure they're doing okay. We now have another 41 sites that have gone live in the last 12 months.
The go live was quite smooth. There were a few teething issues, things like how to print, which we hadn't quite gotten our heads around, but the team was very present on the floor, plus on the phone.
They followed us up, and I personally think that they did a pretty good job and helped us all to get our heads around it.
So instead of having all those people that we'd normally log a call with and have to wait a couple of days for them to get back to us, we had them all here right at our fingertips.
We know what we have to do, so we come in, we train, we go live, we support.
What makes me passionate about working in rural eHealth is the impact that it has on our patients that we deliver care to and the communities in which they live in.
I grew up in a rural area, so I've always been passionate about, coming back and giving back to the rural community. I get to roll out EMR in my hometown in about 2 months' time, which is really a little exciting.
It's really exciting to be able to be a part of a team that can make a change like that happen.
If we can impact a singular person, we've done our job. If we can stop a person from having to travel a lot of distance, we've done our job. If we can ensure that a diagnosis isn't missed or ensure that the information that's needed for a diagnosis is ready at hand, we've done our job.